As your loved one's primary caregiver, you may find yourself continually striving to accommodate changes in their needs and striving to accommodate your personal needs and the needs of others in your life. Communication is essential in meeting these challenges. The first step is to be brutally honest with yourself. Make a point of taking a reality check on how you're doing and feeling each week. As important as it is for you to communicate honestly with yourself, it's equally essential to remember that appropriate communication with the person receiving your care is the cornerstone of caregiving. You must communicate effectively to provide truly helpful and loving care. Your first step to more positive communication with the patient is to identify and accept your loved one's current physical and mental condition. This can be more difficult than it sounds. Your relationship with the patient may have changed dramatically since their illness began. You may be grieving the loss of the companionship the two of you previously shared, or you may have difficulty adjusting to your loved one's diminished capabilities. Other obstacles can interfere with your ability to communicate effectively with your loved one. These include the patient's mental and behavioral status and hearing, speech, or language problems. Remember, it's essential to always respond calmly and patiently so your loved one won't feel any added sense of frustration or anxiety. Regardless of your situation, don't give up. Continue to search for creative solutions. Whatever the patient's abilities or limitations, try to follow these 10 basic communication guidelines. First, always speak to the patient as an adult in a clear and respectful manner. Also, talk to the patient as if you expect a response. Many patients can understand what you're saying, even if they don't respond. Control the emotional tone of your voice. If you feel frustrated or angry, take a minute to calm down before talking to the patient. Explain in advance the care you're about to perform so the person knows what to expect. Encourage the person to make choices about what to eat, where, or do, even if he or she can only manage very simple decisions. Encourage the patient to express any change in their condition. Encourage the patient to share with you or other trusted individuals any emotions or feelings of grief. Respect the patient as a unique person with meaningful life experiences to share. Allow the patient to talk about past experiences, even if you've heard the same stories many times before. Ask for the patient's insights and advice. Showing that you value your loved one's opinion makes a positive contribution to their self-worth. Talk about daily events and experiences outside the caregiving situation, even if the person doesn't seem to understand or respond. Another important rule of thumb is to accept the fact that your loved one can only change their behavior if they want to. You cannot force your loved one to adopt a more positive attitude or to become more self-sufficient. Try to be patient and realize that your loved one may be struggling with complex emotional or medical challenges that may limit their ability to respond more positively. Effective communication with healthcare providers can greatly improve your loved one's care. Never be afraid to ask a question, no matter how silly it may seem. For many caregivers, it's helpful to make a list of questions in advance, so when you're at the physician's office or when a healthcare professional visits your home, you won't forget to ask something important. If the provider is too busy to address all of your concerns at that time, schedule a special consultation session. Never expect people to read your mind. Let them know when you need assistance and tell them precisely what you find helpful and what services you'd like to see provided. By establishing effective communication with your caregiving circle, you'll feel more positive about your caregiving role and you'll be better prepared to make important decisions. At some point during the caregiving process, the person you're caring for will probably require some kind of medication. This can include prescription medication as well as over-the-counter remedies. A common area of confusion for both patients and caregivers involves what is meant by the term medication. A prescription medication must be ordered by a licensed healthcare provider according to state and federal laws. In actuality, however, there are many products which fall under the category of medicine, most of which people never even consider.
Most people, when they think of medications, they think of something that the doctor has prescribed for them, that they bring to the pharmacy and we fill. But really, you should consider it to be more anything that you put in your body. Food can be a medication, alcohol is a medication, the over-the-counter aspirin that you buy is a medication, along with the prescription drugs that we fill for you.
This is why it's so important that before prescribing any medication, all healthcare providers are aware of the patient's complete medical history and of all the medicines your loved one is taking.
I think everyone should have a list of all the medications they're taking, what is prescribed by the doctor, have the trade name, have the generic name written down, have the name of the doctor that prescribed it, have the dosage written down. Are they supposed to take it at bedtime? Do they take it before their meals? Do they take it after their meals? 2 times a day, 3 times a day? How are they supposed to take that medicine? They should have on there things like, why am I taking it? And included on that sheet should be if they are taking Tylenol for headaches, how often they take that. Do they take antacids? I think if you have a comprehensive list of everything that that patient is taking, that gives you a great tool when you're talking to your pharmacist, when you're talking to your doctor, when you're talking to your nurse, to help that patient get the best care.
What we do in our office is that when somebody comes in new, we ask them to bring their medicine chest in. We want to see what they've been taking or what's in there. And sometimes we go through some interesting type of things. For example, old medicine, a lot of people don't look at the date. Out-of-date medicine can definitely be a harm to someone, especially someone who's immobile and that you're taking care of them for an extended period of time.
As you've just seen, it's very helpful to keep a reference list of all the medications your loved one is taking, the dosage, what it's taken for, and when it is taken. This should include not just prescription medicine, but caffeine and alcohol intake, as well as over-the-counter drugs, herbal preparations, and vitamins.
There's a large body of evidence to show that vitamins do help. There's also evidence that shows that certain vitamins are better to use in certain illnesses. Now, there is no hard and fast rule of which vitamins to use. My recommendation usually is to take 1 good multivitamin a day. So again, the amount of vitamins that you're taking should also be listed with the medications that you're taking in.
In addition to the problems that vitamins can potentially cause in certain patients, over-the-counter products can have a similar adverse effect.
A lot of people are now using ibuprofen, they're using naproxen and other types of medications now that are called non-steroidal anti-inflammatory drugs. These are very good drugs to use to help someone with pain or fever. The problem is if the individual is taking aspirin, for example, you wouldn't want to give that with them because aspirin can interact with that non-steroidal. So the amount of medication that's given in a comfort way needs to be addressed, first of all, with the physician, and then with the nurse that may be helping you care for that person.
Before the healthcare provider prescribes any medication, it should be explained to you why it's being prescribed and how it should be taken. You should also be concerned about potential interactions, drugs, food, or other substances that should never be taken with the medication.
Ask them, is there going to be a problem with this? Will this interact with anything that they're already on? Ask them, do I take it before meals? Do I take it after meals? Do I take it with or without food? Some things you should take with a lot of water.
Another essential matter to share with your healthcare provider and pharmacist is whether your patient has ever had any medication-related reactions or side effects. If you don't specifically ask the physician or pharmacist about what side effects to expect, you may overlook a potentially serious situation. Oftentimes, side effects can disguise themselves, so you may not associate the symptom with a specific medication.
There's several hypertensive agents, high blood pressure medicines, that one of the side effects is an annoying cough. Well, how many people think a cough? You know, you think you've got allergies or you've got a tickle, but it is a side effect, and you may need to have the medication changed to something that doesn't do that. A lot of times the side effects are transient. They don't stay for a while. If you're on the medication, they will go away, but sometimes they're annoying enough or harmful enough that the doctor will need to change the medicine.
Naturally, you will want to report any signs of side effects to both your healthcare provider and pharmacist. Likewise, you'll want to do the same if the patient shows any signs of a drug allergy after taking a medication.
You should know your drug allergies, what you're truly allergic to. Be sure that the doctor's office knows them. Be sure that your pharmacist knows them.
As the caregiver, you'll naturally want to ensure that your loved one takes any medication correctly and safely. You can accomplish this goal by following 4 guidelines. Number 1, determine if the patient can take any or all of the medications independently. Sometimes it can be a difficult call as to when you may need to take control over your loved one's medication needs. The doctor and nurse should help you make this assessment. However, if there's any chance that your loved one could be confused or forgetful with regard to their medication schedule, it's time to gently but firmly take over this responsibility. Number 2, when supervising or administering medication, check for the 5 rights: the right medicine, the right dosage, the right time, the right route, and the right way.
One of the most important things that a caregiver can do, or any patient can do, is be familiar with your medicine, with what it looks like. If you've always had a little purple tablet and today it's a little white sugar-coated tablet, well, you should question that. You should ask, this looks different. Is it the same medicine? A lot of times it's changed. A lot of times it's a different manufacturer. A lot of times mistakes are made.
Once you get home from the pharmacy with the medicine, you'll still need to double-check the label each time to ensure you're using the right medicine.
Probably the most common error that a caregiver makes in dispensing medication is not reading the labels and being sure they're giving the right thing. Going back to my idea of a medication list, know what you're supposed to be giving, know when you're supposed to be giving it, but read the labels every time. Don't think because you always put that bottle back in that particular place that that's what it is.
When you read each prescription label, it should include the drug's name, what the drug is for, the dosage, and directions for taking it. Be sure to ask the pharmacist to include the expiration date as well. As an added precaution, you may want to keep medications that look similar or have similar names in different places. Then mark the bottles containing these medications with different colored markers or tape.
They do make weekly and even monthly little pill cases that have Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, and they are small that you can just put 3 or 4 pills. I have them that go Sunday through Saturday. They also have breakfast, lunch, supper, bedtime as far as what dosing they go. We have people that will spend Sunday evenings filling in their little things for everything they've got to take the next week. It's amazing the number of people that don't read their prescription labels, especially when they're getting refills, or it's something I've been on forever. And you see the doctor and he writes a new prescription and he's changed your dosage on it. Or he wants to take your blood pressure's up a little bit, so he wants you to take this 3 times a day instead of twice a day, or he's up the strength on it. People don't notice, and they should. They should read those labels every time they get them.
You want to be sure you're giving the medication by the proper route. This may seem rather obvious, but the fact is medications can be administered in many ways. When giving pills to a patient, be sure to check if the pill has really been swallowed. Some people tend to indefinitely pocket medicine in the mouth. If the patient has difficulty swallowing pills, they can frequently be mixed with an easy-to-swallow food, such as applesauce or ice cream. However, first check with the pharmacist or physician before opening capsules or crushing medication in a food or beverage. There are some foods and beverages which can affect the potency of the drug, whether a pill or otherwise, if they're digested together. Likewise, some pills shouldn't be cut in half, as air can impact their effectiveness. A plastic syringe without a needle can also be used to draw liquid medication from a medicine cup. If the patient can swallow on command, squirt the medicine into the side of their mouth. Before using topical medications, review the product instructions and wear disposable gloves when applying. Always check with a physician or pharmacist before putting any non-prescription topical medication on a rash or open area. If you're giving an injection or shot at home, you'll need special training. The home health care nurse or other health care provider can teach you how to prepare and administer an injection safely. Do not give an injection until you feel comfortable with the procedure. Sometimes the homebound patient will receive medication directly into a vein, known as an IV, or an intravenous infusion route. Many caregivers can learn to administer and monitor IVs, but only after special training from a healthcare professional. Besides ensuring the right route for the medication, you'll also want to be sure the medication is given at the right time and in the right way. Some drugs, for example, are best taken on an empty stomach or after meals, while some antibiotics shouldn't be taken with antacids. So be sure to ask the physician or pharmacist to clarify any special instructions you should know about the medication. Now that you've taken an in-depth look at administering medication, let's discuss guideline number 3, prevent medication-related accidents. Accidental or intentional overdosage can be fatal. For that reason, always keep medications safely out of the reach of children, as well as the patient if they're confused or suicidal.
A lot of people don't realize that it is a state and federal law that when a prescription is dispensed, we have to put those annoying child-proof lids on top of them. Now, you do have an option. You can request that you get non-child-proof lids or easy open lids, and we're more than happy to do that for our patients.
It's true that most people don't realize the potential harm of using a medication that has expired, but in some cases there can be serious side effects.
Usually when a medicine is expired, past the manufacturer's expiration date of when they say it is effective, what happens is it just decomposes. It becomes less effective. It's not really harmful. There are some that can be very harmful. They metabolize to harmful products instead of helpful products once they have expired. My rule of thumb when I tell patients is if you've had a medication for a year, it's time to throw it out.
Naturally, some medications require monitoring much more closely than others. Insulin is one of these. If you have trouble with your vision, ask the nurse to pre-fill insulin syringes, since the correct dosage is extremely critical for patients with diabetes. If possible, double-check the dosage with another individual each time before administering the insulin. Then carefully follow the physician's instructions for administering and monitoring the insulin in relation to meals and blood sugar level. Other drugs which require special safety precautions include those used for patient sedation. Patients who take sedating drugs are much more likely to fall or injure themselves.
Yeah, another thing you should be aware of if your patient's on some sort of sedating medication is the alcohol potentiation of that medicine. The majority of cough medicines have alcohol in them. Be aware of that because you're going to really potentiate the sedation of the medication they're on.
To ensure the safety of a patient who is sedated, encourage them to remain in bed. Take precautions to protect against falling out of bed by using side rails or placing a low bed in a corner of the room. Put a call bell within easy reach and tell the patient to let you know when they need to get up. Last, but certainly not least, is guideline number 4. Monitor the drug closely and report any unusual symptoms or lack of response. To determine whether or not a drug is doing its job, you have to know its intended effect, what the medication is supposed to accomplish, and by when. You will also need to tell a doctor if a regular medication has stopped working. Also, tell the physician if the patient begins re-experiencing symptoms that were previously controlled by the medication, or if the patient isn't seeing signs of relief after an appropriate time frame. And to re-emphasize the point, immediately call the physician if the patient develops signs of a drug allergy. Look for difficulty with breathing, tightness in the chest, a rash, welts or hives, or swelling of the face or lips. Remember, your pharmacist can play just as important a role in the welfare of your patient as the physician does.
Ideally, I think a patient, especially a patient with multiple diseases and multiple doctors, should have their prescriptions all filled at one place, because that's what we're here for. The pharmacist is the gatekeeper. We're one of the best places to coordinate all of your medicines, to let Dr. Smith know that Dr. Jones has already prescribed something similar to this and maybe they shouldn't be taking both of them, to be aware of this allergy you had to this, or this side effect you had from this medication from one doctor, and then another doctor prescribes the same type of thing. The pharmacist can be a very key player in a patient's care by screening and by knowing all the medicines they're on from all the doctors.
For all these reasons, you'll want to choose your pharmacist wisely and then establish a trusting relationship.
I think you should pick your pharmacist like you would pick a doctor, like you would pick an auto mechanic, like you would pick anything that's going to be taking care of something important to you. I think a rapport, if you're comfortable talking to them, if you feel like they have taken time with you, if you can communicate, if you can ask them that stupid question and not feel like it's a stupid question, I think that's very important. And if you're not happy where you are, go somewhere else. You're not locked in.
An infection happens when a microorganism, usually a virus or bacteria, sets up house in the human body. After a period of quiet growth known as incubation, the germ produces signs of illness. Normally, a healthy immune system is able to handle most germs, preventing or limiting the severity of infection. But someone who is ill or weak is more vulnerable to infection and complications. The single most effective way to prevent infection is as close as your sink. It's called hand washing. Start each morning with a basic hand wash to thoroughly clean the hands and lower arms. Even though you do this each morning, you must wash your hands throughout the day just before you have contact with the patient every time, consistently. To begin, remove any jewelry and roll up your sleeves. If you're using an antibacterial bar soap, lather and rinse the bar of soap before applying it to your skin. Now wet both of your hands and your lower arms. Lather generously with the antibacterial soap. Wash from the elbows to the fingertips, scrubbing between your fingers. Then clean under each fingernail with an orange stick and nail brush. Rinse with warm water from the elbows down, keeping your arms slanted downward. Then repeat the hand washing procedure once again. Afterwards, dry your hands completely with a disposable paper towel. If you do develop broken areas on your hands, you may have to cut back on hand washing. In this case, wear disposable gloves when caring for the patient until your hands have completely healed. It's also wise to screen visitors, household members, and especially children for signs of illness, and keep them out of contact with the at-risk patient while they're having symptoms. You may also want to avoid crowded places during flu season. Another area of common concern is housekeeping measures to prevent infection. You may be comforted to know a person is less likely to catch an infection in the home as opposed to the hospital setting. That's because people often develop an immunity to germs in their own homes. There are, however, some basic housekeeping measures that will help reduce the chance of infection. Keep soiled linens and soiled paper products in closed containers. Dispose of soiled incontinence products and dressings each day. Do not shake dirty sheets or blankets in the air. Disinfect the patient's wash basin, bedpan, urinal, and bedside toilet as directed by the home health care nurse or physician. There are some things you shouldn't wash in the sink, like soiled clothing or articles contaminated by wound drainage or feces. Use clean washcloths and towels every time you bathe the patient. Always use disposable gloves when touching soiled linens, pads, wound dressings, or clothing. Remove or change the gloves before touching any other area. To remove the gloves without contaminating your hands, first grab the outside cuff of one glove and peel it off the palm of your hand while turning the glove inside out. With the inside-out glove protecting your fingertips, peel off the remaining glove, turning it inside out and encasing the first glove. Dispose of the contaminated gloves in a covered garbage can. Sterile technique and isolation precautions are also used to prevent spread of infection to the patient and to other members of the household. The home health care nurse or physician will teach you any of these techniques that apply to your situation. As the primary caregiver, you're the most likely person to first detect and report the initial signs of infection to the nurse or physician. These include fever, confusion, general feelings of ill health, inflammation, or drainage at a wound site.
Many elderly patients do not exhibit the same type of signs of infections that younger ones do. A lot of young individuals will have fever, they'll have a aching feeling. Many times in just older individuals who have a dementia form, they can just show confusion, they can show agitation, and may not even show any other type of infection process.
It's also important for caregivers to understand how infection is spread. For example, cold and flu germs are exchanged by air and hand contact. Knowing this, you should be even more strict about hand washing during flu season to prevent infection. In some cases, the doctor may ask you to wear a face mask around the patient if you have a cold. If the physician prescribes an antibiotic, make sure the patient takes the medication exactly as directed. The patient should also take the medication for the prescribed number of days. Otherwise, the infection could return. No matter what the age or condition of your patient, appropriate infection control is a team effort that takes cooperation and commitment of everyone involved. And you, the caregiver, are a major player on that team. Whenever you see signs of what may be an infection, immediately contact your physician. If you're not satisfied with the patient's progress, or if the condition gets worse, let the doctor know right away. When you hear the word wound, you probably think of an accidental injury, yet caregivers most often care for wounds caused by pressure sores, diabetes, poor circulation, or a surgical procedure. Occasionally, surgical wounds do not heal properly as a result of infection, obesity, or illness. These situations usually require specific wound treatments determined by your healthcare provider. You'll typically be instructed on the procedures to follow by a nurse educator or home health care professional. In other cases, a patient may have a surgical procedure called an ostomy, which is a temporary or permanent opening made from an organ to the outside of the body. Your health care provider should instruct you on the proper care of the ostomy site. Patients with long-term diabetes or insufficient blood flow to the legs typically suffer from a loss of sensitivity in the lower extremities. As a result, they can easily get serious foot wounds from their toenails being incorrectly trimmed, their shoes fitting improperly, even from stepping into a bathtub when they're not aware the water's too hot. Because these individuals are especially prone to foot and leg wounds, they should have their feet checked daily for small cuts, blisters, or injuries which they may not have noticed. When these are detected and treated in the early stages, they're usually easier to control. So immediately notify the physician or nurse with initial signs of any skin breakdowns. Probably the most common source of skin breakdowns in elderly or bedridden patients is the result of pressure ulcers, more commonly known as bed sores. Pressure ulcers are often difficult to heal and can lead to other complications such as infection. Generally caused by pressure or irritation from the bed surface or wheelchair, the first line of defense for bed sores is always prevention.
Pressure ulcers go from the outside in a cone-shaped area, in that the worst damage is going to be next to the bone where that skin rubs on the bone, pushes on the bone. Pressure sores can be treated by various types of dressings, and a healthcare professional would need to help you decide what to use. But pressure sores don't heal unless all infection is removed. So if there's infection, that needs to be treated before you worry about anything else.
Now let's look at the most common factors that put patients at the greatest risk for developing pressure sores. Patients who remain in the same position for extended periods of time tend to develop skin irritations, which eventually break down the skin. Turning or repositioning the patient on a consistent basis is absolutely essential because pressure sores can literally develop within just a few hours. This is why turning bedridden patients should be mandatory every 1 to 2 hours. Another important risk factor for the patient is poor nutrition. To combat this, you will want to be sure your patient follows a wholesome diet with appropriate proteins, vitamins, and minerals. You should also be sure the patient gets plenty of fluids for proper hydration. Incontinence is another factor that can contribute to skin breakdowns.
When you're in the routine course of caring for the loved one at home, checking the condition of the rectum, the backside is very important. So often people are sitting in a chair or in bed and we pay attention to the front of them or to the top of them, but not to those other areas. And they're very crucial because skin sores can develop, which can be very serious problems.
Left untreated, pressure ulcers can destroy the muscle, eventually exposing the joint or bone. In the most advanced stages, wound healing requires skin grafting. That's why it's very important to detect and treat these ulcers at the very first possible moment. When inspecting the patient, be on the lookout for these warning signs. A persistently pale or reddened area of skin, often over a bony area. A small break in the skin. A hard or rough feeling on the skin's surface, or a feeling of fluid developing beneath the skin, like that of a blister forming.
And induration or fluctuation would be another sign that you've got a problem. Induration is when you feel the area and it feels very hard. Fluctuation is when you feel the area and you can feel fluid underneath the skin moving around, then you know you've got a problem. You should never rub on this area. That is probably the worst thing that you can do.
As you've seen, if your loved one develops a wound, notify your healthcare provider immediately so you can take measures to control the infection and promote healing. Meanwhile, keep the pressure off the affected area until it has completely healed. Some wounds are treated with dressings and topical medications to promote healing. The nurse may teach you how to change the patient's dressing. To use clean technique, wash your hands thoroughly and apply non-sterile gloves. Do not touch the surface of the dressing as you apply it to the wound. Sterile technique means that anything that comes in contact with the wound has been thoroughly sterilized. To apply sterile gloves, after washing your hands, open the package of gloves without touching the inner surface. Pick up a glove by the cuff, which has been rolled up to expose the inside of the glove. Holding the glove by the cuff, slip your hand inside without touching the glove's surface. Now, slip the gloved hand inside the cuff of the second glove. Put the second glove on your hand. Once you have applied your sterile gloves, do not touch anything that is not sterile. If you do, you must reapply new gloves before proceeding. Sometimes you may purposely contaminate one hand in order to handle saline bottles or other non-sterile equipment. You must then remember not to use that hand to touch the wound or sterile materials. If the wound is infected, the nurse should instruct you on how to safely dispose of dressings and other waste products. Due to infection, the wound may develop an odor, show signs of increasing redness, or a change in the color or amount of drainage. The patient may also develop a fever and general signs of illness. Report any of these signs to the nurse or physician. You should also report if the wound appears to be getting larger or deeper. If the physician suspects a serious infection, he or she may perform special cultures of the wound site to determine the most effective wound healing protocols. If the wound does not appear to be healing, ask the physician what else might be done. You may want to check with a special wound care center to help patients with hard-to-heal wounds. Nutrition plays a vital part in maintaining good health and preventing and treating disease. However, most caregivers soon realize that ensuring adequate nutrition for the patient can be somewhat challenging. But with a little advanced meal planning, good nutrition can easily be incorporated into the daily household routine. In this section, we'll talk about the basic ingredients of a healthy diet. We'll also discuss patients who have special diet needs or face physical or mental challenges that affect their diet or appetite. We'll also talk about tube feeding, including the care and issues associated with it. Fortunately, most patients do well on a normal diet. To provide proper nutrition for those on a regular diet, it's always a good rule of thumb to serve meals from the 4 basic food groups. These include 2 servings of meat, poultry, or protein substitutes like beans or soy products. Also 4 servings of dairy products. By the way, yogurt has active cultures that prevent yeast overgrowth in patients taking antibiotics and those with weakened immune systems. Also 5 to 10 servings of fruit and vegetables, including vitamin C-rich fruit or juice. Remember that fresh vegetables and fruit have more nutritional value than frozen vegetables and fruits. Canned products have the least nutritional value, so whenever you have the choice, always reach for fresh products. And finally, you need 4 servings of bread, pasta, cereal, or other grain products. A healthy diet includes these 4 food groups and will normally contain about 25 to 30% fat. High-fat sources include dairy products, salad dressings, cooking oil, and fatty meats. The diet should include some fats from cold water fish or sunflower and flax oils. Check with your physician or nutritionist about the patient's fat requirements. The average person also needs 8 glasses of water a day, including beverages with meals. To improve nutrition and keep menus interesting, try combining foods from different groups into single dishes. For example, soups, casseroles, or purees can be made from vegetables, bread products, meat, and poultry. Custards can include eggs, ground nuts, cereal, and fruit, and you can make breads or desserts from fruit, cereal, and nuts. The basic food groups provide you with a general blueprint for nutrition. However, in some cases, the physician may order extra calories or a weight-reducing diet for the patient. Extra proteins may be necessary if the patient has a wound or wasting illness. In this instance, protein supplements can be added to foods or beverages. For patients with high blood pressure or heart disease, the physician may order a low-sodium diet or a low-fat diet. People with diabetes require special diets to maintain a stable blood sugar level. If the patient has difficulty chewing or swallowing, the physician may order a soft or liquid diet. Soft diets include foods that require little or no chewing, such as cream soups, custards, scrambled eggs, and soft cooked vegetables and pureed meats. With good education from a nutritionist, dietitian, or nurse educator, and a bit of resourcefulness and practice, you'll find that most special diets need not disrupt your normal lifestyle. They can easily be adapted into your grocery shopping and menu plans. Even when the patient appears to be eating well, you should watch for overt signs of nutritional problems. These include weight loss or gain, low energy, poor wound healing, and dehydration. The patient's blood tests may also reveal signs of a nutritional imbalance. In these cases, the patient will generally require an adjustment in diet, medication, or other measures to improve food intake and digestion. The doctor may order a special liquid supplement based on the person's diagnosis and energy requirements. There's a wide variety of products now on the market. However, always check first with a doctor or nutritionist before giving the patient an over-the-counter liquid nutritional supplement so that you have the professional guidance on what's most appropriate for your patient. Caregivers can also take effective measures to encourage the patient to eat and digest food more properly. The most common eating problems stem from poor appetite and altered mental states, such as confusion. If poor appetite is the problem, try to determine its cause. Sometimes confusion can create feeding problems. Perhaps the patient needs more exercise and fresh air to stimulate hunger. Elderly people frequently begin to lose their sense of taste as they age, so that many foods become indistinguishable one from another. Or for some patients, only highly salty foods or highly sweet foods are appetizing. In some cases, eating can become a control battle between you and the patient. If you suspect this is the case, allow the patient to choose from a wide variety of foods, including some special treats. You might also ask a family member to assist the patient with meals for a time. Try not to put too much emphasis on eating. You might actually heighten the control battle, making your efforts counterproductive. Appetite can also be impacted by nausea. Nausea is often caused by illness, odors, medical treatment, or sometimes even emotions. In many cases, nausea can be alleviated by medication given before meals. It also helps to serve the patient bland, low-fat meals and snacks. At other times, a patient's medications may suppress their appetite. Antidepressants and some cold or allergy medications, for example, can decrease normal desire for food. When this occurs, you can take measures to help stimulate the urge to eat. For example, serve meals in a relaxed social atmosphere or on an attractive tray, restaurant style. Invite friends to dinner or share a special treat with the patient. Or try different recipes and spices to jazz up the menu. To aid digestion, the patient should eat in the sitting position whenever possible. If these efforts are unsuccessful, the physician will sometimes order medications to stimulate digestion. You may find it helps to keep an ongoing nutritional log. Jot down what you serve the patient and what portion the patient actually ate. In this way, you can easily identify favorite foods and estimate the patient's calorie intake. As a caregiver, you may be surprised at how little the patient is actually eating until you record it through your daily log. Otherwise, a dramatic weight loss might be the only other indication that the patient is having nutritional complications. To combat this, serve high-calorie foods rich in protein like milkshakes with honey or frozen yogurt. To prevent dehydration, encourage the patient to drink water throughout the day, as well as with medications and snacks. At mealtime, serve small portions that won't overwhelm the person. You might also try serving 5 or 6 mini meals instead of 3 larger ones. Encourage patients to feed themselves whenever possible. If you must feed your loved one, place small bites on the fork or spoon, but let the person choose the order in which to eat the foods. Or serve finger foods that the person can eat independently. For example, finger sandwiches can be made with whole grain bread and spread with a homemade blend of soft meat, vegetables, and soft cheese that can provide the basics for a complete meal. To prevent choking, encourage the person to chew thoroughly each bite. In some cases, it may be safest to withhold liquids until the person has finished chewing and swallowed the food. In fact, some caregivers even wait until the meal is completed to offer liquids. To enhance mealtime enjoyment, generously praise the patient for eating well. You may also want to stimulate the appetite before mealtime by telling the patient about favorite foods you're preparing. For some patients, the physician may prescribe intravenous nutrition called total parenteral nutrition, or TPN. TPN requires the physician to insert an indwelling intravenous catheter. The patient then receives specially formulated solutions to meet some or all of their nutritional needs. Depending on the digestive capabilities of the patient, the individual may be able to supplement TPN feedings with regular food. The greatest risk to TPN patients is infection. There's a large amount of sugar in TPN solutions that can create an ideal medium for bacterial growth. Therefore, it's essential to use good hygiene and careful hand washing whenever handling or changing the TPN solution. Caregivers for patients on TPN also need to recognize the signs and symptoms of hypoglycemia or low blood sugar. When the patient is first administered TPN, the sugar from the solution causes an elevation in the patient's blood sugar. Consequently, the pancreas begins producing insulin to process this sugar. If the solution is suddenly stopped for whatever reason, the pancreas may continue to produce insulin, resulting in a dramatic drop in the patient's blood sugar. If the patient suddenly gets weak, sweaty, shaky, or irritable, the caregiver may need to check the patient's sugar level or provide additional feedings. You should call the physician or nurse if this problem persists. Some patients can tolerate an interruption in feedings easier than others. Another form of supplemental feeding that the physician may order is called tube feeding or enteral nutrition. Tube feedings are often administered through a nasogastric tube inserted through the nose or mouth into the gastrointestinal tract. The nurse helps the patient swallow the tube and secures it to the face with paper tape. The nurse will then teach the patient and/or the caregiver how to check the tape and secure the tube. The patient's nostril will need to be cleaned with a moist cotton swab. Always check with the physician or nurse before applying any ointments to the nasal area if it should become crusty or irritated. In some cases, the physician will surgically insert a more permanent feeding tube into the patient's stomach, known as a gastrostomy tube. If the patient's gastrostomy tube comes out for any reason, immediately call the physician or nurse and follow their instructions. Do not try to reinsert the tube unless you've been specially trained how to do so by a healthcare professional. TPN or enteral treatments are typically prescribed for patients with cancer or AIDS or those who have trouble swallowing or digesting their food. Sometimes the physician will order tube feedings when a patient cannot or will not eat due to altered mental states or psychiatric illness. If your loved one is receiving special nutritional feedings, ask how long the physician expects to prescribe the treatment and any complications that may arise. You should feel satisfied that you have exhausted all other ways to meet the patient's nutritional needs before these measures are undertaken. There are also ethical and legal issues involved in starting and withholding these treatments for patients who cannot decide for themselves. It's important to discuss any concerns you have with the healthcare team and your family. If necessary, consider seeking advice from an attorney about the legal and ethical issues related to these life-sustaining treatments. If your loved one does receive intravenous nutrition, the nurse should teach you how to care for the catheter site. With proper training and practice, you can become adept at administering intravenous nutrition or tube feedings. Do not agree to do so, however, until you feel comfortable with the procedure.